Now, a new programme is being launched today here in France to help people cope with the psychological consequences of the Covid-19 pandemic. So now, anybody aged over 3 years old will have access to 8 free sessions with a psychologist. The measure was first announced by the French president back in September of last year, but the platform dubbed My Shrink has already sparked some controversy here in France. And to discuss, our health editor Julia Seeger is with me. And Julia, before we come on to that controversy, just tell us a bit about how this platform works.
Well, the platform just opened today, so we're discovering it as we speak. But according to the website, it's called, you said it, Mon Psy in French. It means my shrink. Any French person over the age of 3 suffering from, I quote, mild to moderate psychological symptoms can have access to these 8 free sessions with a psychologist within a year. But there's going to have to be a referral from a general practitioner. Now, the fee is covered by the state health insurance to up to 60%, and the rest is taken and covered by private health insurances. And all you have to do is go to the website. There's about 1,000 practitioners that are, listed on the website, and you can make an appointment there. Now, it's often referred to as a state initiative, but I think it's important to stress the fact that it's actually private insurance companies that first started to try to tackle this problem, because many studies were already coming out saying how much younger people, but also the elderly, were being affected mentally by the pandemic. And they started by offering the coverage of 4 consultations. And it's only in September, after a huge symposium on mental health, that the French president kind of stole that idea and then proposed 8 free sessions.
Well, let's talk about some more of that criticism, Julia, because psychologists are saying actually it's been quite hard to recruit people who want to take part in the scheme, psychologists, that is.
That's true. There are many things that psychiatrists are saying about this new platform. The first one, of course, is the fact that these free types of consultation already exist in France through a system called the Medical Psychological Centers, but they actually lack funding in a big way. And also, there's a 2 years waiting list. And this is why many psychologists are saying that all of this money should have been poured and allocated to the existing structures that already exist. Another criticism is the fact that these structures are for patients who present, as I said, mild to moderate symptoms, psychological symptoms, when in fact practitioners are saying that on the ground, the types of patients that are coming into their office are actually presenting post-COVID-19 quite severe psychological distress. And so this is why we're hearing that the platform is no longer about psychotherapy, but it's much more a low-cost psychological support system. Now, out of the 28,000 psychologists in France, only about 1,000 actually applied so far. There's another sticking point. It's the money, of course, because it's a state initiative. Doctors can't charge what they want. So the first session is charged about 40 euros, and then the following session's 30 euros. It's nothing when you know that, for instance, an assessment interview is about an hour, and following follow-up sessions are about 30 to 45 minutes.
So the system may have some problems in the way it's been designed, Julia, but clearly the problem of mental health is a very real one here in France and, of course, throughout the world.
Absolutely. Many studies show and have shown now for several months that COVID has had a huge impact on the mental health of people on a purely, biological and medical level. It's believed that severe cases tend to trigger psychological disorders. According to a study by the Lancet Psychiatry, 46% of people diagnosed with a severe form of COVID-19 who were hospitalized went on to develop some sort of psychological disorder. Now, the context, of course, of the pandemic as well, and the social restrictions have had their toll also on people. According to a study this time by the University of Zurich, about 1/3 of young people between the age of 12 to 17 have somewhat of a psychological disorder, which is huge. Among them, 15% have developed, more specifically, anxiety, 10% have developed depression, and others have developed what we call attention deficit disorder, and that's also linked to a higher screen time during lockdown. Even more alarming, according to a study here in France, twice as many people say that they're having suicidal thoughts than in 2017. So I think it's important to say that if there were to be new restrictions and another lockdown, many psychologists are saying that it's important to try to have a better balance, to try to maintain routine schedules, social contacts, but also these existing structures during the lockdowns.
Julia Seeger, our health editor, thank you very much.
Thank you.
Indeed.